Hello, this is Dr. Ford Brewer with PrevMed, heart attack and stroke and cancer prevention. Why prevent a disease? Why take a cure when you can prevent it altogether? Love to hear your comments. Please provide those and share if you like the information. Today I'm going to be talking about Liraglutide and the incretins. We'll talk about what that means in just a minute. Liraglutide is the generic name. You may have heard it under Saxenda, Saxenda, or Victoza. Saxenda is a weight loss medication, and Victoza is a diabetes medication. This Victoza was approved in 2009 by the European equivalent of the FDA and approved in 2010 by the US FDA. For use as a diabetic drug. After just a small time of experience, Victoza was found to have a significant side effect of weight loss. So like any big pharma, Novo Nordisk, the maker and owner of Liraglutide, said, wow, we've got a huge opportunity for major profit. If we change the name and put it out there as a weight loss medication. That's exactly what they did. They got approval to do so. And here's what happened in terms of their numbers. This is a blockbuster drug. Victoza, when it came out in 2010, within a couple of years got up to $2.3 billion with a B dollars in sales. That was before they changed the name and indication and added Saxenda. $3.5 billion in 2015. So again, a huge moneymaker for Novo Nordisk. So why has it been so profitable? Well, let's go back into the history of these types of medications. The class of medications called incretins, Incretin, class was discovered by a Dr. E-N-G. He's a doc in New York that was doing several different types of research on hormones and was looking at a gut hormone. He found that Gila monster saliva, let me repeat that, Gila monster, the lizard out in Arizona that can be very vicious and bite you. He found that the saliva of this lizard mimics a hormone in the gut, the human gut, called GLP-1. And that became very interesting, and here's why. GLP-1 has an impact on human insulin. And I'll get to the punchline on the potential advantage here, and it is a significant advantage. Victoza, like the other incretins, will increase insulin, but only if the blood glucose is high. Now, why is that an advantage? Well, if you think about it, the other medications like insulin, for example, metformin doesn't do this, so it doesn't have this problem. Insulin has a major problem in if you give insulin and the blood glucose is already low, you can get a huge decrease in blood glucose from the normals in the 80s or above down to 20s, 30s, and those levels they'll not only make the patient pass out, they're dangerous driving or operating machinery, and it can kill a patient when you get down into the 20s. A normal hypoglycemic episode may go as low as 50, 60, in that range. So again, 20 is a huge decrease and a significant danger. So the incretins avoid all that, but still help to maintain a lower glucose. So that's what the advantage was in the diabetic drug area. So 2010 FDA, they put out Victoza, get a great response. Actually, the Victoza was already a blockbuster on the diabetic side alone, with $2.3 billion in revenue for 2014. But by that time, Novo Nordisk had discovered that this also decreased appetite, and a lot of people lost weight on Victoza. So what's any good pharma going to think about when they have a side effect of weight loss for one of their medications? Aha, maybe we can turn this into a weight loss drug. Sure enough, they did. The new name was Saxenda. So now you have Victoza on the diabetes side and Saxenda on the weight loss side. Revenue in 2015 had climbed from the 2.3 billion to 3.5 billion. Again, we're talking about with a B. So these are major drugs. Now, there are two subtypes of the incretins. One is the DPP-4 inhibitors, which would be Januvia, Saxagliptin, Victoza, Saxenda. The other ones are the GLP-1 agonists. They're injectables like Byetta. So we'll talk about those a little bit more deeply later on. Anyhow, one of the there's a major advantage that has come to light in terms of Victoza for diabetics as well. What's the number one killer of diabetics? It's heart attack and stroke. It's mainly heart attack. Diabetes greatly increases your risk for heart attack. There has been some information in clinical trials. They call them CVOTs, cardiovascular outcome trials. Since 2008, the FDA has required that any company making drugs for diabetes should look at the specific impact on the number one killer, and that's cardiovascular outcome. The leader trial had to do with Liraglutide and did show decreased cardiovascular outcomes. We'll talk about that in a different video. Again, I'm focusing a little bit more on the weight loss impact here. But let's talk for a minute about the real mechanism of action. If you go to the pharma slides and a lot of the other videos, you'll see a lot of very glitzy and exciting videos showing impacts with hormones. I don't think, when you look at it more deeply, it looks like it might actually be a simpler mechanism and may be hormonally impacted. But that mechanism appears to be basically decreasing gastric emptying. In other words, it closes the outlet of the stomach and you feel full. So that does appear to be the major impact for both Victoza and Saxenda. Now, so it sounds like a great drug, right? Well, there's significant debate here. Before 2013, there was a nonprofit group called Public Citizens Research Group. They petitioned the FDA to have Victoza removed from the market. Why? Significant reports of thyroid cancer and pancreatitis. Obviously, the manufacturer didn't like hearing that and did not encourage that awareness of those major side effects. In 2013, based on further concern about pancreatitis, there was a deeper analysis by physicians at Johns Hopkins, my alma mater. They found significantly increased hospitalization due to pancreatitis. Now, why the association of pancreatitis? I think there was a potential answer that came up later. It came from a physician at UCLA. His name is Peter Butler. He is really good at a very, very difficult type of autopsy, basically where you're looking at the pancreas. And the pancreas is difficult to examine during autopsy because of the fact that it releases enzymes which digest itself after death. Dr. Butler showed an increased beta cell and islet cell mass. You may remember we talked about a couple of advantages or potential advantages to the incretins. One of them was that they decreased death of beta cells. Well, not only did they decrease death of beta cells, it appears that they caused maybe growth of beta cells. But here's the problem. The growth of the beta cells appeared to be very disorganized, and it appeared to be the disorganized type of growth that may lead to pancreatitis. So significant medications, making a lot of money. A lot of people are having good impact with it, but there are significant side effects as well. Just like we said, there's always something. In addition, be careful if you are taking these with alcohol. We can talk about that later too.